Hello everyone, Dr. Suneel Dhand, internal medicine physician. In this video, I would like to talk about a question which I believe is one of the most underutilized by doctors and other medical professionals in healthcare. And that is, after seeing our patients, after taking the history, doing the exam, simply asking them, well, what do you think is wrong with you? This may seem like a very strange question. I mean, I'm the doctor, I'm here to tell the patient what's wrong with them, right? But actually, I find this to be an amazing question for a number of reasons. Firstly, it shows that I respect the patient. It fosters a human connection. I'm interested in what their opinion is. And also, more importantly, I find that most of the time, our patients already know what's wrong with them. They will say something like, oh, doc, I think I've sprained a muscle. Oh, I think I've got fluid on my lungs. I think I'm picking up another infection. Oh, that headache, it's probably due to all the stress in my life. They will actually tell us what is wrong with them and ends up being true in the end after all the tests. So why would we not get that information? And too often in healthcare and medicine, we underestimate the intelligence of our patients. Obviously, I exercise my own judgment on when it's appropriate to ask this question. I usually ask it in a friendly way anyway, after I've got the history. But I really find it to be very useful. We still have in healthcare too much of a paternalistic approach. And it's getting better. It's certainly better than it used to be, but it's still there. A lot of doctors have a sort of high and mighty attitude, think that they must be the ones to be in charge and they shouldn't be asked any questions. And I really think we have to get out of that mentality. I know over the last few years there's been a lot online about patients using Google, and there is a small percentage actually of doctors who are really annoyed by that. How can our patients use Google and find out all the background to their illness and come at us with questions that they may have printed out? I mean, I actually think it's marvelous that patients are doing that. Can you imagine going back to a time when the doctor's word was absolute and you had no recourse to get extra information? There was no additional data or opinions available to you. I mean, literally now everything is at our fingertips. And of course, you have to be careful with that and you have to discuss everything with your doctor. But it's perfectly okay to always be doing your own background research online. And coming back to the main question then, what do you think is wrong with you? Really is a question that I do think many medical practitioners could benefit from using. A very wise professor once told me when I was in medical school that the good doctor knows the diagnosis 90% of the time after just talking to the patient. They don't need to lay a finger on them. They don't need to order any tests. They know. And for those of us who are practicing medicine, we know that that's true a lot of the time. And asking our patients, what do you think is wrong with you, is a great additional piece of information. Thanks very much for listening. Dr. Suneel Dhand. Follow me on YouTube and Facebook, MedStoic Lifestyle Medicine. We will speak again soon.